In this video, you will learn why onions, despite their reputation as a superfood, can be extremely dangerous in certain situations. We will explain which health conditions make it absolutely necessary to avoid eating onions, which illnesses they can make worse, and what research says about it. This is not just a list of restrictions, it is valuable guidance for maintaining health and promoting longevity. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. Never eat onions if you have a blood clotting disorder. Onions have long been considered beneficial for blood vessels because they are rich in flavonoids, especially quercetin, and sulfur-containing compounds. However, these same substances can pose a serious risk for people with clotting issues. Quercetin can reduce platelet aggregation, which is the ability of blood cells to form clots, by as much as 30 to 50%. This means the body becomes less able to stop bleeding quickly, whether due to an external wound or internal injury. In the United States, more than 3 million people live with blood clotting disorders, including hemophilia and von Willebrand disease. In addition, many people take anticoagulants, blood-thinning medications, prescribed after heart attacks, strokes, or to manage atrial fibrillation. If these individuals eat onions regularly, the time it takes for bleeding to stop can increase by an average of 2 to 4 minutes, which, in the case of a serious injury or surgery, could have life-threatening consequences. This risk is especially high for older adults over the age of 65, whose bodies already heal more slowly and who are more prone to falls. Medical studies have shown that 7 out of 10 patients with clotting disorders who include a large amount of raw onion in their diets experience an increased risk of both minor and major bleeding episodes, ranging from nosebleeds and bleeding gums to internal hematomas. If you have been diagnosed with a blood clotting condition or are taking blood-thinning medication, you should either completely remove raw onions from your diet or consult your doctor before continuing to eat them. Never eat onions if you have gallstones. At first glance, onions might seem like a harmless vegetable. However, for people with gallstones, they can pose a serious health threat. Onions have a strong choleretic effect. They stimulate the production and release of bile by nearly 50%. While this can benefit digestion in healthy individuals, it becomes very dangerous for those with gallstone disease. According to American medical associations, more than 20 million people in the United States have gallstones. What makes this condition especially tricky is that for most people, it remains asymptomatic for a long time. But when someone with either undiagnosed or known gallstones eats a large amount of onions, the risk of an attack rises sharply. The onion-induced bile production can trigger the movement of stones. If a stone becomes lodged in the bile duct, it can lead to a severe pain episode called biliary colic, which often requires emergency medical attention. Statistics show that 60% of patients with stones larger than 5 millimeters experienced worsened pain within 1 to 2 hours after eating foods high in onion content. In some cases, surgical procedures were needed to remove obstructions from the bile ducts. If you've been diagnosed with gallstone disease or are at risk of developing it, for example, women over the age of 40 with excess weight face a 2 to 3 times higher risk. It is best to avoid consuming large amounts of onions on a regular basis, especially in raw form. Never eat onions if you have severe kidney failure. The kidneys are responsible for removing excess potassium from the bloodstream. When kidney function is impaired, even a slight increase in potassium levels can lead to serious consequences, including dangerous heart rhythm disturbances and, in extreme cases, cardiac arrest. Although onions are considered a healthy vegetable, they contain a relatively high amount of potassium, approximately 146 milligrams per 100 grams. For someone with healthy kidneys, this amount of potassium is not a concern. However, for individuals with advanced kidney failure, it can be extremely dangerous. In the United States, around 785,000 people live with end-stage kidney failure, a condition in which the kidneys can no longer effectively filter the blood. In such cases, excess potassium quickly leads to hyperkalemia, a condition where muscles, including the heart, may stop functioning properly. Medical observations show that patients on dialysis or those with severely reduced kidney function begin to experience increased potassium levels as soon as 2 to 3 hours after eating foods rich in potassium, including onions. Just one meal containing a large amount of raw onion can raise blood potassium levels by 0.3 to 0.5 millimoles per liter, which becomes critical when the kidneys are no longer able to filter efficiently. For people with kidney failure, carefully monitoring potassium intake is essential for survival. In these cases, onions must either be completely removed from the diet or consumed only in amounts approved by a doctor or dietitian. Never eat onions if you have serious heart conditions. Many people believe that onions are good for heart health, and it is true that they can help lower blood pressure and improve blood vessel elasticity. However, for individuals already suffering from severe cardiovascular diseases, such as chronic heart failure, coronary artery disease, or arrhythmias, this so-called beneficial effect can actually become a serious risk. The reason lies in the active compounds found in onions, including quercetin and sulfur-containing substances, which cause blood vessels to dilate and reduce vascular resistance. This sudden drop in blood pressure can lead to blood flow redistribution. For someone with a weakened heart, this may result in reduced blood flow to the brain, causing dizziness, fatigue, or even fainting, especially if the person is taking heart medications such as ACE inhibitors, beta blockers, or diuretics. Research shows that in such patients, onions can increase the effects of these medications by up to 30%, which can cause excessive drops in blood pressure or intensify side effects. For example, according to the American Heart Association, 1 out of 6 patients with heart failure who regularly consumed onions experienced episodes of nighttime tachycardia, unstable blood pressure, and swelling. In this way, even a common food like onions can disrupt the balance of the cardiovascular system in people with serious heart conditions. Someone who previously felt stable while taking prescribed medications may begin to experience stabilization after adding large amounts of onions to their diet. That is why individuals with heart disease should be cautious about eating onions and should always consult with their healthcare provider to make it to their diet. Never eat onions if you are taking anticoagulants or antihypertensive medications. If you are on medication to lower blood pressure or thin the blood, onions can unexpectedly turn your treatment plan into a source of serious risk. This is because onions affect the same biological pathways that these medications target. For instance, quercetin and other active compounds found in onions can dilate blood vessels and slow down blood clotting, exactly what antihypertensive drugs and anticoagulants are designed to do. If you are taking medications such as warfarin, aspirin, clopidogrel, metoprolol, losartan, or others like them, consuming large amounts of onions can enhance their effects by 20 to 30%. This may lead to consequences such as a sudden drop in blood pressure, dizziness, weakness, internal or external bleeding, increased risk of bruising, even from minor bumps, and more frequent nosebleeds or bleeding gums. According to statistics, about 1 in 5 patients undergoing antihypertensive or anticoagulant therapy who regularly consume onions experience side effects that require medical adjustment. The risks are especially high for older adults and those with additional health conditions, such as diabetes or kidney failure, where the body's ability to compensate is already weakened. For this reason, if you are taking any of the listed medications, you should not add large quantities of raw or cooked onions to your diet without caution. Consulting your doctor is essential to help you balance your diet in a way that supports your treatment without putting your health at risk. Never eat onions if you have low blood pressure. Onions have a strong vasodilating effect due to their bioflavonoids and sulfur-containing compounds. For people with high or normal blood pressure, this can be a beneficial property. However, for those who suffer from hypotension, onions can lead to serious problems. After consuming approximately 100 grams of raw onion, blood pressure typically drops by an average of 5 to 7 millimeters of mercury. For someone with normal blood pressure, this change is barely noticeable. But for people with already low blood pressure, such a drop can cause a sudden lack of oxygen to the brain, leading to dizziness, weakness, darkening of vision, and even fainting. This is especially dangerous in older adults or when low blood pressure is combined with other vascular issues, such as varicose veins or impaired cerebral circulation. American studies have recorded that about 20% of people with hypotension who regularly consumed large amounts of onion reported feeling worse, experiencing dizziness when changing positions, and having more frequent episodes of fainting. If you are prone to low blood pressure, it is best to limit your intake of large amounts of raw onion and closely monitor how you feel. Never eat onions if you have pancreatic disorders. The pancreas is one of the most sensitive organs in the digestive system. It is responsible for producing enzymes that break down proteins, fats, and carbohydrates. When a person is healthy, moderate stimulation of the pancreas by foods like onions generally does not cause problems. However, in cases of pancreatitis or other pancreatic issues, the gland becomes unstable, and any additional stimulation can trigger a flare-up. Onions, especially when raw or fried, intensify the secretion of digestive enzymes. This happens due to their active compounds, particularly organic sulfur-containing substances, which irritate the mucous membranes and increase reflex activity in the pancreas. For an inflamed pancreas, this stimulation becomes a serious stressor. The organ starts producing enzymes when they are not needed, which can lead to the breakdown of its own tissues and worsening inflammation. According to the American Gastroenterological Association, 42% of patients with chronic pancreatitis who ate onion-containing dishes experienced symptoms within 3 to 6 hours. These symptoms included pain in the upper abdomen, nausea, occasional vomiting, and increased bloating. Flare-ups were especially common after eating fried onions, as the volatile compounds in them become even more aggressive toward the digestive tract lining. That is why doctors strongly recommend that people with pancreatitis completely eliminate raw and fried onions from their diet. In some cases, small amounts of boiled onion may be allowed as part of diet-friendly soups or stews, but only with approval from a gastroenterologist. Never eat onions if you have gastritis or peptic ulcers. Onions are a vegetable with a very active chemical composition. They are rich in essential oils, enzymes, and organic acids, which can irritate the lining of the stomach upon contact. For a healthy stomach, this stimulation may actually aid digestion. But for individuals with gastritis or ulcers, onions pose a serious threat. In cases of gastritis, the stomach lining is already inflamed, and with ulcers, there may be actual open sores present. When the aggressive compounds in onions come into contact with this sensitive tissue, they can worsen inflammation, cause spasms, burning sensations, and pain. Raw yellow and red onions are especially problematic, as they contain the highest levels of irritating substances. Green onions or boiled onions are somewhat gentler, but even these can cause issues during the acute phase of the illness. Clinical studies have shown that 8 out of 10 patients with gastritis or peptic ulcers experienced a worsening of symptoms after eating dishes containing raw onions. They reported increased heartburn, pain in the upper stomach area, and a feeling of heaviness or fullness, even after light meals. Some patients also experienced minor bleeding from ulcers, which required urgent medical attention. For anyone with chronic stomach conditions, onions, especially raw, should be eliminated from the diet. Even small portions can lead to a serious decline in health. Nutritionists recommend replacing onions with more gentle alternatives, such as cooked vegetables or soft green herbs like dill. Never eat large amounts of onions if you have excess body weight or a metabolic disorder. Onions are usually thought of as light and low in calories. However, for people with obesity, metabolic syndrome, or insulin resistance, this vegetable may not be as harmless as it seems. Onions, especially when consumed in large quantities and in raw form, can affect blood sugar levels. They stimulate the production of insulin, the hormone responsible for regulating glucose levels. In a healthy person, this helps the body process food properly. But in people with impaired insulin sensitivity, the body can overreact. Onions trigger a stronger insulin release than necessary, which can cause blood sugar to spike and then crash, leading to hypoglycemia. Studies conducted by American endocrinologists have shown that when patients with metabolic syndrome consumed more than 100 grams of onions per day, they experienced blood sugar fluctuations 15% more frequently. These episodes were often accompanied by fatigue, sudden hunger, and even trembling. Additionally, cravings for carbohydrates increased, which led to overeating and further weight gain. Onions can also influence leptin, a hormone that regulates feelings of fullness. In cases of chronic overeating, leptin regulation becomes disrupted, and the addition of large amounts of onion to the diet may worsen this imbalance. As a result, people with obesity may unknowingly consume more calories than needed. Therefore, despite its reputation as a healthy vegetable, onion can interfere with weight management and worsen insulin resistance in individuals with metabolic issues. This is especially true for dishes containing large amounts of fried or caramelized onions, which carry an even higher glycemic load. Never eat large amounts of onions during pregnancy. Pregnancy is a special time when even familiar foods can unexpectedly affect the health of both the mother and the baby. Although onions are rich in antioxidants and vitamins, consuming them in excessive quantities may pose risks. The active compounds in onions stimulate intestinal movement and increase gallbladder activity. For a pregnant woman, this can lead to increased muscle tone, not only in the digestive tract but also in the uterus. This becomes especially concerning during the first trimester, when the placenta is still forming. Statistics show that about 18% of women who consume significant amounts of raw onion, more than 100 grams per day, experienced signs of increased uterine tone and a risk of pregnancy complications. These findings have been confirmed by research in obstetric clinics across the United States. Additionally, in some women, the intestinal stimulation caused by onions leads to bloating, which further irritates the uterus and increases its sensitivity to contractions. There is also an increased risk of allergic reactions, which tend to become more intense during pregnancy. To avoid unnecessary risks, pregnant women are advised to limit their onion intake and to eat it cooked rather than raw, as cooking reduces its stimulating effects. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.